Hi, this is Kevin, Randy, and Eamon, and we're doing our presentation on the Waterpik.
The Waterpik is a great alternative for patients with orthodontics, with braces, and for patients who have a hard time cleaning around implants. Um, the Waterpik is also great for patients with periodontitis, gingivitis, or patients who have high risk for developing periodontitis, such as patients with diabetes. And patients who don't like the traditional string floss or use incorrect flossing technique may be missing some spots, which will leave some subgingival plaque. But if the patient uses the Waterpik, they'll find it easier to use because it involves less manual dexterity. The Waterpik is an oral irrigator which uses a concentrated stream of water to remove plaque biofilm. It can be used to cleanse the entire mouth. Now the cool thing with the Waterpik is that they come with a variety of different tips, such as high and low pressure jet tips, tips specialized for orthodontics, and tongue cleaner tips.
Okay, advantages for the Waterpik would be patients who are perio involved and patients who are have orthodontics, such as braces. Disadvantages would be they are expensive, they take up room in the bathroom, and they also require a lot of maintenance to clean, and it is a little bit messy for people who don't like water getting sprayed all over their face. Yep. There are not really any contraindications, but if there were, it would be patients with hypersensitivity. To use the Waterpik, you'd have to take the tip of the Waterpik and put it at a 90-degree angle to the gum line. And you're going to want to activate it. Well, there's no water, but you turn it on, and you would just trace the gum line of the teeth and go on and cover the whole dentition, then move to the linguals, and then repeat for the bottom.
Before using the water tip, first you want to select the appropriate tip and insert into the handle. Most Waterpiks come with several color-coded tips, so each member of the family can have their own separate tip. Then you're going to want to open up the Waterpik's reservoir, and you're going to fill the reservoir up with lukewarm tap water. After filling up with water, you're going to want to turn it on over the sink so you can adjust the water pressure. Set the water pressure to the lowest setting for the first use. A Waterpik with a pressure adjustment on the handle makes it easy to operate. You can experiment with higher pressure settings once you got the hang of how to use the Waterpik. Place the tip in your mouth before turning it on. Lean over a sink and close your lips around the tip to keep water from splashing out of your mouth and onto your face or clothes. Turn on the Waterpik and allow the water to flow from your mouth down into the sink. Make sure you start on the molars and work your way around. Trace the gum line and let the Waterpik work its magic. Once you're done using the Waterpik, you want to remove the tip from the handle and properly store it somewhere safe. Dump out any remaining water in the reservoir. Remember to clean the device before and after use.
Hi, my name is Kevin, and this is Randy, and Eamon is recording, and we are doing our presentation on the Waterpik.
The Waterpik is for patients who have ortho, who don't like traditional flossing, or can't reach for the back molar. The Waterpik is for patients who have ortho, who don't like to